everyone. Hello there. This is a dressing of a toe demonstration. I have the lovely Jackie from the Kensington Physios with me today. Now normally this is because of an ingrown toenail and an infection. Usually it's the big toe. So what we're going to be doing today is, you may not necessarily have this sterile pack, but that's not too important. However, you will be issued with a dressing pack, of which in a moment. We're going to be using firstly Clinisept Plus, which is a fantastic antimicrobial. From here, you're going to be given within your pack what is called topper, which is a sterile dressing. The toe has Clinisept on here. We're going to be lightly patting the area in an upward direction and repeating that with the second gauze. We then proceed to the primary inadine dressing. Usually 5x5 is sufficient for a toe. And the dressing will look like so. I like to cover all around and to the second toe to try to make the whole area as sterile as possible. And we're going to be covering our first dressing directly on the toe. The next secondary dressing is a melalin dressing, and this is a non-adherent dressing, of which we're going to be making sure it has two sides. It's the shiny side that will be facing downwards onto our toe. From here, we're going to be using Hyperfix, which is a breathable hypoallergenic material. And it's important, especially with an ingrown toenail, that we don't wrap around squeezing potentially the nail more, but we go from front to back. So it's quite a adhesive material, and you're going to simply from front to back lightly plant in the Hyperfix like so. We're then going to move on to the container dressing, tubi gauze, and this is size 12. 0, 1 or 1 are for smaller toes. What we're going to do is from here, we're going to plant the tubi gauze lightly, more stretch from the back part of the toe. We twiddle the material around. That's a little bit long, so we're just going to cut that a little shorter. And then from here, we're going to just replace the tubi gauze over one more time. Our last piece of the dressing will be our second piece of Hyperfix. And what we're going to do is, that's just to seal down the dressing so it doesn't come off, because usually we like a dressing to be in situ for between 24 and 48 hours. So we're going to have a piece secured at the front of the toe and a piece secured lightly at the back of the toe. Of course, if you have any other questions with regards to your dressing, please do call us on 0207 101 4000. We'll be more than happy to help you. Thank you.